I'm very excited to be back tonight. I think there's a lot of new things to share, new updates to focus on, just as we start to thinking about how we're going to head back into the practice or clinic or wherever we might work. And there's considerations, and not only for ourselves as whether clinicians, practitioners, whoever you might be. There's considerations for us, and there's also considerations for the people that we are helping support. And I'm going to try and touch on those throughout the session this evening. So a little bit of a background about myself. Starting into research, I came into research from a background in competitive sports. I was a professional athlete for about 4 years on the Canadian sailing team, very focused on sports performance, personal performance. And during my research career at U of T, I started to work a little bit more in different clinical aspects of nutrition, and which I found interesting because there's a lot of differences and also a lot of similarities when we look at people's performance capacity and what might be important for an athlete in terms of improving their stamina, endurance, their strength, is also very important for people who have different health conditions. Everybody wants to be able to perform better, and everyone's better or what they're working towards is very different, but I've since transitioned full-time into the diabetes area, focusing on nutrition, and I've found that to be more rewarding than working with athletes. And I think that's really important work that we're doing. And a little bit about me on a personal front, the guy who's on the other end of the screen. My family and I, we live outside of Toronto in Canada. We had snow about 10 days ago, and thankfully it's all gone. But we live on a little hobby farm where we have a couple horses and get to do some pretty fun things. And often Manny gets to hear my chickens when we're on the phone together. So that is all good. Just a couple disclosures before we get into the heart of tonight's presentation. On the left, some organizations that have supported my clinical research program have and continue to do, and also some of the commercial work that I do in terms of taking my clinical research outside from the clinic to the medicine cabinet, as I like to call it, really working to bring the nutrition therapies that I work on in my clinical work and make that available to people who really need it. So a little bit of an overview for tonight of what we're going to try and accomplish, and just working clockwise around, starting with an update on what we know in terms of COVID-19 and diabetes, and just a little bit of who's at risk, what does that mean, how can we help, and talking a little bit about why it's important that we continue or restart working with people with diabetes, and how do we manage that. I have a couple thoughts that our group has been working on in terms of workplace strategies, and also some personal health and performance concepts that I want to share with you. And especially on anything on the lower half of the screen, this is just really my take and some of the experience that we're working with, that we're getting from our clinical group at Mount Sinai Hospital, and also just really want to start to get people thinking, if nothing else, from tonight. So I just want to start out talking a bit about COVID-19, and what we know is this virus is a very, very strong virus, very intense virus. And a lot of people, especially through news media and various different sources, the information gets a little bit skewed in terms of people who are at risk versus general risk for having the virus. And it's really important to note and to clarify that viruses work on an equal opportunity basis. It's the job of a virus to find a host as quickly as possible, settle in, and go to work. So people with diabetes or heart disease or any underlying health condition they're not more likely to get the virus. Everybody's equally as likely to get it. What the challenge is people with underlying health conditions are more likely to have poor outcomes. And when we talk about poor outcomes, that could be anything from the virus affecting the lungs through to ending up on a respirator or risk of death. And that's what we really want to work hard on in terms of protecting. So when we look at the data, when we first gave a talk for Neuberg, which was almost a month ago, we were really focused on all of the risks and the information that was coming out of China. And what we still know out of that data or that group is, and they've been very well studied, is that people who have a higher risk of death from the Chinese cohort, we see them more likely, almost 2 times as likely to be male, 1.7 times more likely to be over 65, individuals who have high blood sugar, and almost a 4 times higher rate for people who have had cardiovascular disease or other heart-related issues. And if you look at this and you think about it, who is more likely to have a negative outcome from any virus, whether it's regular flu season or a more intense version like coronavirus? And by and large, this holds together quite well. The fact that people with cardiovascular disease history are more likely to die as a result of COVID has a little bit more to do with how the virus affects different parts of the heart and the kidneys, but this is really what we know. And as we move across in terms of the data which is coming out of New York City, and I just want to put a little bit of a caveat around this. We haven't seen as much data or as large a data set come out of the States yet. Things are still relatively early for that. So we don't have all of the same information yet, and it's still a very evolving situation. But what we have seen so far, published, especially in journals like New England, is we're seeing similar trends, which is good to see. It shows the initial data was relatively consistent, but one of the more interesting things that we've seen is that individuals in the U.S. we're seeing more issues or negative outcomes for people who fall into the obese category with BMI. And if we think about it, we don't have the same risk or information in terms of diabetes, but if we look at these numbers all together, we can see that generally anyone here who is passing away from this virus is likely on the diabetes spectrum, meaning they're somewhere between pre-diabetic and diabetic with complications. It's just a matter of whether they know their health history or not. So I think anyone who has underlying health conditions should be very careful and very conscious about their risk factors, especially when out in public. And again, viruses are equal opportunity. It's just a matter of how hard it affects your system if you do get infected. So ultimately, what are we taking away from this? Be very careful. Please instill that message into your patients or clients that being careful is the best preventative tool. Be purposeful in your actions. That goes full stop, but especially for people who are in a higher risk group. So talking about return to work, and I don't classify it as work. A lot of what I do, especially on the research level, it's not really about work. It's about help. It's about figuring out different ways that we can share knowledge so that we can help people. And people with diabetes, it's we're gonna focus on that group because one, that's my background, but two, that's one of the more at-risk patient or clientele groups that we see. And if you're somebody who doesn't have a lot of diabetes patients per se, but you work with individuals with autoimmune conditions or something similar, I think we can generalize some of this information to those who are at risk. And I think I'm conscious that some of you might have been seeing emergency patients or clients throughout this lockdown period, but which is great and very important, and we thank you for that. But what's important to consider is being on the other side is not all individuals with foot issues, they won't necessarily consider themselves emergent. So they might have been having issues at home, which we would consider emergent or needing to be treated right away or managed, but that doesn't necessarily feel the same for the client. And so I suspect that many of you will start to see different challenging cases as your doors open, as you start to work with more and more clients. And I think through this sort of hierarchy of risk or patient risk, we often classify, or whether we do it on paper or in charting, or just sort of keep mental tabs on some of these individuals, we know who the emergency or the high risk individuals are, and we're often in more contact with them. But especially through this period of less contact, maybe changes in personal routine, it can also be individuals with unknown health status that can have some of the most serious changes in their foot or lower leg health overall. And I think what's concerning is that these people are likely the ones, people who have neuropathy and don't actually know it, people who might be pre-diabetic or diabetic and haven't been diagnosed. They're at the highest risk for some of these concerns, especially given the weather change, especially up here in Canada, the weather change, increases in activity, going from winter boots to shoes, maybe going to sandals, being outside, gardening, walking more. These are all things that can really increase our risk for foot, not necessarily foot ulcers, but foot damage, foot trauma, cuts, or rub marks and wounds that could get worse very quickly. So I think a little bit of our focus as we go back should be about understanding health status, making sure that everybody's up to date, and keeping an eye out for those people who have an unknown health status, who could be at more risk than our more obvious clientele. And one of the things that in making this presentation I was really thinking about is that health status unknown, and especially as we get more and more data coming out of the US where things are a bit different than here in Canada, there's something that I was really starting to think about, which is high risk hiding in plain sight. And if we think about the diabetes spectrum, if you will, going from people who have pre-diabetes through to diabetic complications, there's in the US, and we'll pick on the US statistics for the time being, but there's over 20% of people who are undiagnosed. They don't know that they have diabetes. And that's, from a healthcare or health provider standpoint, that can be very worrisome. And it might not necessarily be that they don't know. They might know that they have some symptoms, but they either haven't seen a family physician, they don't have a family physician, they can't afford one. anything on that in that area. And so as the foot health professional, I think it's important that we are conscious of this, because 20% of people are at much higher risk for lower limb problems, but also thinking back in terms of the mindset of our current pandemic, they're also at much higher risk for poor outcomes if they were to contract the virus. And if we shift from diabetes to prediabetes, just in this nice little infographic here, the lack of knowledge in terms of health status is even higher in the prediabetes situation. While about 1 in 3 individuals have prediabetes, about 80% of those individuals don't know that they have prediabetes. So again, a huge area for risk factors for personal health, but also for COVID health. And I think as the foot professional, we want to really make sure that we're dealing with, we're helping to educate and helping to refer to the appropriate resources for improving an individual's health. And I think, as we look at this, a lot of people might not have family doctors, or they might not have access. So if they see that they have a foot problem, you might be the frontline person, regardless of profession, that might be able to direct that individual for more information, or at least communicate with them about what the risks are in terms of if they don't get their health either looked at, improved, managed in a certain way. And if we think about this on a broader scale, this was a great study that was done by Armstrong, Dr. Armstrong, DPM in the States, and this got a lot of traction. His study looking at different foot complications in relation to 5-year mortality. And I think I caught wind of this figure, this concept about, it was 2 years ago at a conference for diabetic neuropathy. It's a very small but tight-knit group, and this was something that really, at the time, caught the group a little bit surprised when it was being presented. But diabetic foot ulcers or foot complications are very, very serious risk factors in terms of keeping patients alive. And if we look at a foot ulcer, the red bar there on the left-hand side of the figure, it has a very similar 5-year mortality to any type of cancer. And that's really, really mind-boggling. And then, if about around 30% of foot ulcers will progress into amputations, and minor amputation generally will progress into a major. And you can see how a diabetic or somebody on the diabetes spectrum can easily hop along this graph in terms of their 5-year mortality risk. And it's becoming very scary, especially as we're seeing data from the Ontario Health Registries and other US registries showing the incidence of amputations are increasing in the past 10 years. So where does this all come back together? It means that there's a lot of people who could have let their foot health lapse over the past 6, 8, 10 weeks. And there's also a very, very good opportunity for us as foot care professionals or diabetes complication researchers to really get more emphasis on screening, detection, monitoring, and making sure that those of us who are actually hands-on with feet are able to talk to patients and communicate information about risk on all aspects of their health, not just blood sugar control, not just COVID risk management, but also making sure that foot health is really maintained, because that's going to be one of the most serious health risks that these individuals have going. So we're talking about this in terms of assessing health changes, and it really depends, what you're able to do really depends on your scope of practice, and your scope of practice depends on your profession or where you live, depending on where your state or provincial college lies. But regardless of your scope of practice, whatever you're allowed to do, that's very important. But measurement is essential for assessing change, and that goes for all. And I think if we don't take notes, if we don't assess, if we don't look at something, we're not able to determine if it's changed over this lockdown period, if it's changed year over year. So it's just another important note to say, you know what, let's keep some notes within scope on our individual patients so we can, or clients, so we can make sure that everybody is, we're helping to improve health, and if health is not improving, that we're able to direct or inform or talk to an individual about what their options are. So there's a lot of different things we can do, and it isn't necessarily, doesn't need to be, assessing health changes doesn't need to be overbearing or overly intense or awkward. It can be as simple as having a conversation, just asking a few questions about what's been happening in changes in health during an assessment or a treatment, or taking a health or complete medical history. There's two complete ranges, and while for some it might not be relevant to do a full medical history, it would be important to ask a couple highlight questions about what's going on or changes in health since they've last seen you or the last year. Then also for some professionals, doing a full medical exam, monofilament test, an in-Lowe's foot screen, or other assessments can also be warranted. And I think especially given what's gone on over the past 9-10 weeks, I think it could be very important to reassess your patients or clients once things come back in, because it's not necessarily the time that has passed, although it could be a lot for some of your patients or clients, but it's also the amount of stress or the other factors that have affected an individual's health over the time. So now I want to talk a little bit about work management strategies as we start to open the doors, start to see clients again. For some of you, maybe that hasn't happened yet, but it will. And I just want some of these thoughts and concepts to at least resonate or cause you to think a little bit more about it. And I know for some individuals, it could feel easily like there's a tidal wave coming at you. You haven't seen your clientele in however many weeks. There's going to be backups of appointments. There's so many people to see. Everybody needs help, and that can get a little bit overwhelming. But I think what's important in this situation is to think about yourself as being the lead or the center of this situation. And you need to reestablish hours so that you can work back into the full capacity that you were at before. And, some of you might have been working 10, 12-hour days. Is that something that you want to do, can do, think you should do after being off for, say, 10 weeks or 6 weeks? So maybe starting back at a slightly reduced hours so you can build your stamina back up again. The other thing to consider, especially for if you're working with patients or clients who are at higher risk, perhaps consider setting times specifically for your patients and clients that have either diabetes, autoimmune conditions, or seniors who would be higher risk, so everyone feels safe in terms of being at your facility. And also thinking about the increased appointment time, that could be from 2 points. One, to account for infection control, and also two, to account for redoing health assessments or checking in to see what has changed. So something to think about there. And again, infection control time, how do you and your staff want to handle cleaning in between visits? Where do patients go? Using different rooms, all important things to think about. as well as personal time. And this comes back to, how are you going to manage your energy throughout the day? Do you want to set a lunch period? Do you want to set two say break periods when you can take a little bit of a physical and a mental break, to make sure that your energy levels stay up, both mental and physical energy, especially as we get back in the first 2 weeks, which will likely be a little bit more intense. And it's often, I know, especially in clinic when we're doing research and having research participants through, it's really easy just to get caught up in the rush of go, go, go. But if we're not looking after ourselves during this time, it's very easy for any number of slips to be made in terms of infection control or any number of other things. So I think as we going forward purposefully and cautiously at the same time. Now, I want to talk a little bit now, we're shifting into the bottom half of our points, but lifestyle management. And I've picked 3 aspects of this to highlight on today. And I'm going to pick sleep as the first one. And I think sleep is probably our most important aspect as we go back and start to go back to work. And I think it's the most important because it's usually the first thing that gets sacrificed. And sleep is just so important for so many levels, but also in terms of, I think is most important right now in terms of managing your immune system. And sleep is directly related to immune health. And as soon as we get into a sleep deprivation period, and that means missing more than 3 hours of sleep, we see a lot of negative changes happening. And if we take a step into the sports performance world, we know that one night of sleep deprivation in athletes, so not enough sleep, that has direct impact on their physical performance, and specifically its performance through their brain communication with muscles. Their athletes aren't able to put out as much force, and their muscles fatigue more quickly. So, not to mention the immune factors as well. But going back to work, we need to make sure that we're carving out enough time for us to get the sleep that we need to keep our minds healthy and our bodies healthy. And how much is enough sleep? That's a great question. And right now we know a lot of adults are sleeping 4 to 5.5 hours a night, and that's really not enough. I would say the minimum amount of sleep for anyone to get would be 6 hours, and ideal would be about 7.5 hours. So just keep that in mind when you're starting to plan your days and your routines. Minimum of 6 hours, 7.5 would be ideal. Our next lifestyle management aspect is exercise. And what we have is a little graph here showing a relationship between physical activity and risk of upper respiratory tract infection. So that would be any sort of cough, cold, but can be translated out to being impaired immune function. And what we can see from this is that individuals who exercise moderately at a moderate intensity for a moderate duration, they have a below average risk of getting sick. So what does this mean? Essentially, if we do a bit of exercise, sort of 20 to 30 minutes a day, maybe up to 45 minutes at a moderate intensity, so getting your heart rate up, getting a little bit of a sweat on, that helps to keep your immune system strongest. By being physically active, we help our immune system stay more active and healthier as we go forward. So I think that's an important point to note as well. And just the final area, and I think this is always a good question, especially if we're working with patients or clients with diabetes, is how are we managing nutrition for general health, but also general immunity? And looking back over my research and what we've been suggesting for the past year or so, things haven't really changed. And before, whether it was pre-COVID to post-COVID, the recommendations are still the same. There's nothing, there's no super exciting, only eat cabbage diet and it'll keep you coronavirus free. That's not the case. When it comes back to daily nutrition, it's a matter of doing the little things right and doing them consistently. And our group has been consistently recommending the Mediterranean diet because of its relationship with reducing diabetes risk. And we've been doing that consistently for over a year now. But there's a lot of things within this eating plan, if you will, that can be very important for not just general health, but also helping to keep people healthy if you were to come down with a cold, flu, virus, what have you. And I think one of the most important things is we're focusing on an eating plan or an eating style which is generally low glycemic index. So we're seeing a lot of whole grains, a lot of legumes and potatoes. So really carbohydrate-rich sources of carbohydrate, which don't really change our blood sugar levels much. There's a good focus on protein, which is very important for keeping our muscles and our immune systems functioning. And we also see a lot of colors in sort of that first bottom section of the pyramid. And a lot of different colors translates into high antioxidant content, lots of vitamin C, especially from red, orange fruits and vegetables, a lot of antioxidants from greens. So generally a very well balanced program here. And also the final point is the amount of fiber that we're seeing here from whole grains, which relates back to the GI comment, but fiber and those prebiotic nutrients are very important for keeping your GI system healthy. And a lot of our immunity actually comes from the intestinal tract, which a lot of people might not know, but keeping those little microbes, those little bugs that we have in our intestinal tract fed and happy is very important for keeping you protected and your immune system up. Okay, so what am I doing? I just wanted to share a little bit about how I'm trying to manage myself, my day. What am I doing? Excuse me. In terms of a lifestyle factor, right now, generally sleeping about 7.5 hours and trying to get to bed in bed around 10 and then usually up around 6, really taking advantage of the sun coming up to help me get up and out of bed. Then I'm trying to get my exercise in right after I get up, which is hopefully before my daughter wakes up. And then if I can't get my exercise in there, I'm blocking 30 minutes in the afternoon to be outside. Also, what I'm dealing with is stress management. And I think this whole coronavirus situation has been very, very interesting and very challenging in different ways. And I think I've noticed that my stress levels have changed daily. Some days totally fine, other days it's been much more stressful, and it's not necessarily anything to do with the virus itself. It's a matter of balancing family life, managing, keeping everybody fed, happy, and just all of those different things which create different challenges. So I think finding either some time to do some breathing, some meditation, if that's something you do, or even just carving out 5 minutes for yourself in a day, just so you can check in, de-stress, or get some time to yourself. I think that's really important. In terms of nutrition, generally we're trying to stick to the Mediterranean plan. Through the newsletter that we have, I'm trying to send out what we're eating at home. And that's just been something that I thought has been fun, and to try and help share with people who are on our newsletter list to see what we're eating. Sometimes it varies because at the end of the day, we also have to feed a 2-year-old and get food into her. So we're trying to focus on veggies, fruit, protein, and low GI carbs, but really trying to emphasize stable blood sugar. That's what I'm trying to do, just not only from a personal health standpoint, but also from a performance, productivity, good mental health standpoint as well. The other aspects of defense in terms of what I'm using, this goes back through a number of different aspects, but one, omega-3s, because they help with inflammation, very important for keeping health up overall. Also, I'm using it to try and help manage my stress. When I first gave this talk a month ago, I was still taking vitamin D3 because we weren't getting much vitamin D from the sun. That's since changed. I'm trying to get outside time to get my vitamin D that way, which is directly related to keeping immune function up. Antioxidants I'm getting from foods, so I'm not worrying about that from a supplement basis. And probiotics, I was taking those, but stopped about 2 weeks ago. And I was on a cycle of those because I'd been on antibiotics for a sinus infection. I just really wanted to make sure that I rebuilt the good bacteria in my gut to try and keep my immune system up that way. I think from everything that I've been seeing, I'm happy with that and have tapered those off. So the other thing which we can offer, or which comes back to my clinical research, just in terms of sharing with everybody here tonight, we've developed, through my research, I've developed 2 different products. One's a diabetes supplement, which helps with blood sugar control, food cravings, and generally supporting nerve function. This is something that has just come out. We launched in sort of February. So as we start to get back into, as clinics and other locations start to open up, we're going to start to chat with you a little bit more about that and how that can perhaps fit into some of the support that you're providing for any of your patients or clients that might be on the diabetes spectrum. This is something that we're hearing, especially clinically. People are really looking for a nutrition therapy or ways that they can use nutrition to try and help keep their blood sugar in check before progressing to medication if required. And then also our neuropathy supplement, which is an omega-3 supplement, which was the first product we released from my clinical research, showing that we're able to support nerve health and also nerve regeneration for individuals with any sort of neuropathy. For those of you who've been with us for a while, you'll note the label change. We've changed from diabetic neuropathy supplement to just neuropathy supplement to keep to be as inclusive as possible, and that's what our field studies are showing in terms of support. Then finally, we've partnered up with a company based out of Vancouver, Biomed. They provide a lot of naturopath-based supplements, but in terms of getting any sort of immune supplements to any healthcare providers or foot professionals, they've allowed us to work with them so that we can just try and keep anybody healthy who might be working with patients or potentially putting themselves at risk. So this is now something that we have available to our network as well. So there we go. So if anybody needs any more information for any of this, we're more than happy to send you any of the clinicals that we have, and look forward to supporting you and supporting your patients and clients as they start getting back to health. So I really thank everyone for their time. If you have any questions, please putting them into the chat box, and we'll start to work first on a first question in basis. And I really appreciate your time, and thank you very much.